incision between the two lobes, but that is not what is important. What is important is what you see coming to the side, and here again we have a clear-cut VASA PRAEVIA in this multilobe placenta. Another case here from François Masson, from France. The anterior lobe is over here, posterior lobe is over there, and here we have the cord that is in front of the cervix, and the cord picks up a lot of color, but when you tap gently and move the cord to the side, then you can see this baby also has a VASA PRAEVIA, and these are the vessels between the two lobes of this bilobated placenta. Another example here of a marginal placenta. You can see the placenta is over here, and that I think is a frightening example to me, because that is probably one of the only one that I have that has an anterior placenta and a VASA PRAEVIA. And of course there's no reason why that should be. It probably means that when I have an anterior placenta, I didn't look carefully enough at the cervix. And here we have a little dot that in grayscale looks suspicious, but in color is definitely a case of VASA PRAEVIA. A few pitfalls and a few artifacts. When you take images too early in the gestation, you see the chest of this baby is about 1 centimeter across. This is the 3-vessel view at 10 millimeter chest. Well, those vessels are often just volume averaging of maternal vessels, and they may not be VASA PRAEVIA. So if you have any doubt, you do a pulse wave into this, but probably the better idea is to rescan the baby in the 2nd or the 3rd trimester. Here we have, in front of the inner os, we have a little nodule that looks very much like the cross-section of the vessel that I showed you before, but when you put Doppler, there is no signal into that. That is just a simple amniotic fold, and so that patient should not be scared unnecessarily. Here we have a baby that has, just in front of the cervix, some low-level echoes, and so we could think with grayscale that might be a VASA PRAEVIA, and then we put color, and we have flash of color, but look at these colors. These are colors that are in both directions, so the flow is going towards the transducer and away from the transducer, and you see that the boundaries of this flow is quite different from one image to the other. This is not a VASA PRAEVIA, this is slushing of the amniotic fluid as the baby is moving and turning around. So this is another example of that. You can see the inner os over here, and in red you can see some flashing artifact of baby slushing the fluid around. So that is not a true VASA PRAEVIA, and that patient should not be made unnecessarily nervous of what she has. You see the big red flash over here. This is a Funic presentation in which the cord is in front of the cervix. What you do then is just tap gently the abdomen and move, or if it's a transvaginal examination like this, you just press with the transducer and move the cord away, and that clears the confusion. The differential diagnosis for linear structure in front of the inner os may also represent a marginal placental sinus, a chorominic separation, or simply a fold of the membrane, and these are easily excluded by doing color Doppler. Or you can have marginal placental sinus, and sometimes you have maternal heart frequency, and that usually it's just venous, and usually it's just blood clot, and you don't see anything, but the fact that you don't see Doppler is what is the most important. Other diagnosis procedure, well, you can do digital palpation of the VASA PRAEVIA. I'm a radiologist, so I'm clearly quite incompetent for doing this, but I think you must require a lot of experience in order to be able to do that. An amnioscopy, I can guess that when you have a rush procedure to look at, you don't want to go and find out where the amnioscope is located and whether it's been sterilized since the last time. And those blood tests, or fetal blood, are probably things that are relegated to the past because people don't have the experience of doing this in routine. And so these have mostly a historical significance. MRI, sure, you can probably do this with MRI, but that may be overkill and a bit more expensive, because clearly color Doppler is the easiest thing to do and is available so widely. Now, in order to think about VASA PRAEVIA, let me propose the following algorithm. And again, I'm a radiologist, not an obstetrician, and I would welcome any criticism of this before we make any big mistake. During the 2nd trimester ultrasound, I think the first thing to do is look at the placental cord insertion, not the fetal cord insertion, the placental cord insertion, and the lower margin of the placenta to see whether it is far from the cervix. If both conditions are satisfied, then we have a baby that has no risk and no further assessment is required. On the other hand, maybe we have a succentrate or multilobate placenta, a filamentous insertion, a multifetal pregnancy, a low placenta, a patient that has conceived through in vitro fertilization, and then I think it is quite easy to look through the abdomen to look at the cervix with color Doppler. In case the exam is strictly normal, then we go back to the first condition and there is nothing further to be done. But if we have any doubt, I think it is quite justified to do a transvaginal examination and do a color Doppler. If the color Doppler is normal, we're fine. If the color Doppler is not normal, then the patient is treated as having a VASA PRAEVIA. And finally, during the second trimester, we may have other reasons for doing a transvaginal examination. For instance, a cervix that is not well visible, some previous history of a problem, and then at that time we go back into the same pathway of either a normal examination at a time or an abnormal finding, and then the patient should be managed differently. Now, what are the associated anomalies? And I think this is completely bogus, but they have been reported in literature. There's a case of cephaloceal, a case of scimitar syndrome. Rabia has shown you what it looks yesterday, and trisomy 21. I believe this is just coincidence and not related.